Greetings, colleagues. I hope you are well. Once again, thank you for taking the time to be a part of this class. I think you're doing a great job in pursuing this particular career when we're looking at public health, or this particular course, HCM 574, which is the principles of public health. And for this particular class, what we're going to be looking at, we're going to be examining the history and the purpose of public health. And I know I'm probably preaching to the choir, but as you know, the importance of public health means childhood vaccinations, and now even COVID vaccinations, flu vaccines, protections against unknown infectious diseases, non-communicable diseases, and things like this, as you have witnessed in your own country when in terms of religious observance, what happens is many times those events are canceled, I know in the past few years because of COVID-19. Right? So these are some of the principles of public health, that there are policies in place, that there are restrictions in place, that there are guidance documents in place at the highest level all the way down to your Ministry of Health that dictates, that tells individuals, tells the communities about the challenges of a possible public health pandemic, or let's say epidemic, before it turns into a pandemic, right? We're also going to be looking at the governmental and non-governmental entities, right? What are the various levels of government that manage public health within the Kingdom of Saudi Arabia? Most importantly, health systems, right? That is the talk of the town, right? The health systems. How do we govern health systems, and how often should we upgrade health systems? What is the best health system to use? Do we need immediate guidance documents and social media guidance that goes out to individuals and to the community every time there's a public health emergency? Yes, we do need these things, right? Hospitals and clinics need to report public health outbreaks as quickly and as soon as possible, okay? And also, looking at public health workers to improve the health of its citizens, that everyone is on board with what is happening. If there's a need for childhood vaccinations or adult vaccinations, that everyone stands to gain from educating the public, training those within your own offices, clinics and hospitals, and throughout your community on the importance of mitigation efforts, right? Just using COVID-19 as an example, right? So when you think about mask wearing, social distancing, working from home, teleworking, things like this, electronic health measures that allow physicians and nurses to communicate back and forth with their patients because they're unable to come into the clinic or the hospital. We're also going to be looking at population and evidence-based health events. So looking at the health events, or looking at population health, what attributed to an outbreak of rabies, right? Where there are loose dogs or loose cats or something in the community. In poor communities, was it as a result of maybe rat infestations in a housing project or in a home or something like this, okay? So we need evidence-based detection measures in place as well. We're also going to look at the history of public health, right? In Saudi Arabia, what is the history of public health? How did it get started? When did it get started? Was it in the 1950s? Was it in the 1960s, right? And I think you'll be finding that out in this course if you don't already know that, okay? And what was the purpose? What was the reasoning behind establishing a public health system within the Kingdom of Saudi Arabia? Also, how public health information is collected. How is it collected? Okay. And do these systems need to be upgraded and improved? What type of technology is being used? And also, when you're looking at urban versus rural healthcare clinics and centers, are people still doing things by writing things down on pieces of paper? Are health records being kept by people documenting, pen to paper? Or are they using the highest level of technology, which is computers or tablets or laptop computers, desktops, and things like this, or phones? What is the highest level of technology that is used? Do we need to improve on that technology? And also, how does public health information, how is it collected and how is it being dispersed throughout the community? Is it being dispersed through a traditional means, maybe through public transportation signage, radio, television broadcast, pamphlets, things like this? Or is it being communicated through the latest forms of social media, right? And what is the best form to use, or should we be using both? So looking at those as well. And the need for improving public health infrastructure and public health systems, okay? Can't emphasize that enough, that hospitals and clinics and the Ministry of Public Health continue to provide and allocate dollars, right? Citizenry dollars, through tax systems, right? To improve on technology-based healthcare systems. Because this is not going to go away. It has to improve as populations continue to shift. We have an older population of individuals who are living longer. Many of them cannot access many of the tools because they're not savvy to social media or using iPhones and iPads and things like this. And so we need to continue to do both traditional ways of communicating with them to ensure that they remain healthy. And to ensure also that they also have a way to get to the hospitals, that there's access to care, that it is affordable, that they are able to get there. I can't emphasize that enough, right? That they have a face-to-face visit with their clinicians, right? Whether it's their nurse or their doctors. Oftentimes when you get older, you don't want to communicate through a phone or through a tablet. You actually want to see and hear and touch your physician or your healthcare provider as a way to reinsure that you're going to be okay as they write your prescriptions, or if you share confidential information with them that they understand. You don't want to do that over a phone or tablet. So continue to have that avenue open for individuals who need to see a physician or clinician in person. So I'm looking forward to meeting each and every one of you. HCM 574, Principles of Public Health. And it is the part of the three-legged stool of healthcare management. So looking forward to working closely with each and every one of you this term. Take care. If you ever have any questions, feel free to reach out to me at any time, and we will talk soon. Bye-bye.